I don't have my family. I lost my family in 1994 in genocide, and I'm orphan now.
Meet 21-year-old Rwandan Abdul Cuisine. Abdul's tragic loss of his mother, father, and 2 brothers is mind-blowing, yet surprisingly similar to the stories of many Rwandans we encountered.
They killed my father with pangas, also my mother, and my brothers. I saw how they are running my brothers in the bush with their dogs, and my brothers they are killing my brothers, and I have one my sister. They cut one my sister here in my head on the panga, and thrown in the water, in the lake. Nowhere you can bring my sister to the hospital because of everywhere was closed. So it means that we take the grasses. There is some grasses here we use like medicines. Yeah, we take many grasses, we mix it, and we put in the head. So, and we take some cloves, and we tie her head. We need enough medicines.
Post-genocide, the need for adequate health care was staggering. The infection rate of HIV/AIDS had greatly increased during the genocide due to attacks of rape. Others were left mutilated, and the psychological effects were devastating. We traveled to the country to document the progress since 1994. Our first stop was Kigali Health Institute.
That the Kigali Health Institute is a young but fast-growing institution that was established by the government of national unity in 1996 to address the problem of the acute shortage of medical personnel that were badly needed by the country. Because of the genocide that took place in Rwanda, many health workers fled the country, others were killed because of the genocide. There was an immense problem of delivering health care. So the government found it a big challenge, and to address that, that's how the institute was established.
In the skills lab, we don't really use the patients. The patients are in the hospital, so we use the mannequins. But in the mind, we emphasize that when you're using the mannequins, feel that you're treating it like the patient in the hospital. And from here, they carry on the skills to the hospital in the real practice. As you can see, she's demonstrating a procedure where we examine a pregnant woman.
But to date, we have about 1,221 students and various departments. We have about 10 disciplines that deliver training related to health professionals.
KHI's rapidly advancing technology and modest resources make it the top medical school in Rwanda. The Institute's graduates cross the entire country, setting up facilities and making healthcare accessible to most anyone, regardless of economic status. Chimirongo is one such health center located in a small section of Kigali. This clinic specializes in the care of female patients, pregnant women, and those suffering with HIV/AIDS. The clinic has very few resources but has done exceptionally well by utilizing problem-based learning techniques.
We have had great support from the Western Ontario, Fanshawe, and other related partners, whereby they are always very well experienced professors that come, review our curriculum. Our lecturers also have been to Canada several times. I have been to Western Ontario myself, and I think the project Rebuilding Health for Rwanda has seen their great achievements.
What happens is stopped, don't worry, so come and you go to the hospital, please don't worry. And they take, some people have problems to the hospital, the doctors take care of them.
These improvements in healthcare have allowed Rwandans to rebuild their once shattered lives. Abdul and his 2 surviving sisters are doing remarkably well today, especially the one injured in the attacks.
My last sister, now she studies at university. And to tell them that don't worry, no problem.